riding this trail since we got here, and we knew it was the only way we could get away from you guys for a little bit.
Understandable. Are you still trying to come up with a compromise with the state?
I am. I still haven't heard from the state, but I hope we can go back into negotiations today.
It's pretty bold of you to go out on a bike ride while the state police are here. Why?
There's no legal action against me, so I'm free to go on a bike ride in my hometown.
What is the status of the court order, Kaci?
I don't know. When you find out, you tell me.
See, that looks like paparazzi. It's the media, because that is a huge story. It's trending on Facebook. Nurse Kaci Hickox is defying Maine's quarantine order. She's not doing it. She's going on a bike ride. She went on one with her boyfriend.
Yeah.
So, Mike, a lot of people are saying, what do you mean? You should be playing it safe.
Not a lot of people
not.
are happy. Some calling it a provocative act. Here's the clock, and here's part of that 55-minute bike ride. We know that a state trooper tagged along, and part of the reason was for her own safety, because people are not too happy about her being out and about like that. So, yeah, he's going to tag along to make sure she's okay. There's no warrant for her arrest. And we know this, that Maine's governor says he will exercise the full extent of his authority allowable by law. What does that mean? We shall see on all of that. Dr. Devi Parampal joins us now, assistant professor, NYU. What do you tell? Is this bike ride a big deal to you or not?
Well, there are a couple things to consider. I mean, I agree with her statements that she's not contagious. I mean, people only become contagious when they're actually having symptoms. So all the photographers, reporters, you know, the state troopers and everybody that is following her around, they're pretty much safe. But I do think there is some reason to be concerned. I mean, we started thinking about this with Dr. Craig Spencer when he traveled around New York City, right? So we were lucky because he only developed symptoms when he was in his apartment, but it raised some questions about what if he was out and about in a public place and started having symptoms? What would you do then? So for my own part, you know, I think that the voluntary quarantine, in-home quarantine, is a reasonable option. And I think this poor nurse was treated very badly when she first arrived here. But at this point, I think she is trying to kind of provoke the issue a little bit by going out on that bike ride.
Yeah, a lot of people are agreeing with you, doctor. And people, though, are also saying, look, we're crossing the line here if we're threatening to arrest someone who's not even sick. I want to read a couple tweets here. Jamie says, stay home. You would think nurses would use moral obligations and want to keep people here safe as well. Amanda tweeted, Maine nurse, why can't you just listen? Why are you fighting this so hard? Respect the guidelines, she says. Think of it as a vacation. Easier said than done, right?
Yeah.
For some of the Twitter followers of ours. But one more, doctor, I want to read one more because Primum actually disagrees. He tweeted this, loving Kaci, big FU to ignorant politicians, a hero on many levels. So, but that's most of our tweets, though, doctor, I will say, are saying do what's safe, protect everyone around you. And she's saying, I am safe. I'm not even sick.
Well, I agree. So I think that, you know, of course, these folks coming back from West Africa are heroes. I don't think anybody's disputing that. And her situation might be slightly different because she's not in a major metropolitan area. You know, she's out in a rural area, and she probably, you know, why does someone else have more right to some of those streets than she does? So with that whole procession, if somebody is afraid, maybe they can stay away. I'm not sure. But I do think in a place that is like New York City or someplace where, you know, your actions definitely can affect other people, I think you have to be a little bit more careful. Now, again, just to emphasize, if she's not having any symptoms, you know, people are safe. It's just a question of when might you develop symptoms if you actually
Well, let's pick up on that point, and let's take a look at the timelines of our nurse, Kaci Hickox, and also Dr. Craig Spencer. We're starting here with the nurse, and again, she's been back in the state 6 days. We don't know, again, when was the last time she saw an Ebola patient? But keep that in mind. Keep that question in mind as we look at the timeline for Dr. Craig Spencer, who we know treated patients and developed Ebola. You take a look at his timeline, and again, he comes back, and we've talked about what he had done, went on the subway, went and bowled, and things like that. He didn't present symptoms for 11 days. So that's kind of the point you were making, isn't it, doctor, that she may be okay now, but she could present, and we just don't know when. It'd be better if she's at home as opposed to out and about.
Exactly, and it depends where you want to draw the line. I mean, she's been tested a bunch of times, and, you know, some of the Maine officials want her to get tested again. That really isn't very helpful, because if you're not having symptoms, you're going to test negative. You only test positive if you have symptoms. So we can see, you know, from the video that she seems to be fine now, but that doesn't really answer the question of what might happen in a few days. So it's really, it's kind of an ethical controversy
It's a tough one. And she's saying, you know what, I'm doing what I want to do. I'm going out on a bike ride.
She's ready to take everybody on.
Yeah.
Yeah. All right. Hey, doctor, thanks again. Appreciate it.